All right, fantastic. We have a great guy. He's now almost exactly a year out. You know, you'll read on the internet, it takes a year for the full swelling to come down off the nose. It's typically, it looks really good after a couple of months, but it's always still rewarding to see a person at a full year because that's classically what we talk about as sort of the end point. So tell us a little bit about your story. Go for it.
So I had some trauma to the left side of my nose. Somebody accidentally bumped my nose and unfortunately had a break in the nose, and it was like that for about 10 years. So therefore had that break, had that bump from a cosmetic standpoint, didn't look too great, as well as some breathing issues. The right side of my nose, I couldn't breathe real well. So looked at about 5 to 6 doctors and landed with Dr. Leong here. Made me feel comfortable from the beginning as we went into the appointments and the follow-up appointments, making sure that we were documenting everything to make sure I was satisfied with the result.
Yeah, so we we follow patients like you just sort of implied there a second ago. We don't sort of do a rhinoplasty and then see you, take the cast off, see you one more time, and then just don't see you for a long, long, long time.
Right.
You know, we want to see the patients back because the healing of a rhinoplasty is a very nuanced, complicated thing. Every now and again, not in your case, but every now and again, you need to put a few drops of steroids in. That may not be very common, but when you need to do it, you need to do it if there's a little bit too much scar tissue formation. So we follow patients closely, and we just looked at the pictures now a year out. And you can look at the pictures yourself. There was quite a bit of curvature on the frontal view, especially when smiling, and it looks kind of pretty close to ramrod straight.
Yep.
And if you look around the different angles, this wasn't just a functional, sort of rhinoplasty. There was definitely a cosmetic component, and you'll see that from every angle. And so that's what we do here. You know, we do cosmetic work overwhelmingly. If in addition to that cosmetic work, there's a little bit of functional nuance that needs to be done, you know, we do it. We're definitive sort of nasal surgeons, cosmetic and functional. So, Any last comment?
I can breathe now.
Okay, good. All right, so thank you so much.
Yep.
Looks good, breathes well, we're happy. Thanks so much.
Thanks.